Okay, thank you all for joining us and welcome to the Sepsis Canada Summit Series webinar. My name is Christine Russell. I identify as she, her, and I am part of the communications team at Sepsis Canada. Today and throughout this series, our research teams will be providing an overview as well as progress to date on their current network projects. We will take about 5 minutes for quick introductions, housekeeping items, and following these, we will begin our presentation. Please feel free to ask questions throughout the webinar today via the chat box. The chat box will be moderated for questions at the end of the presentation, and we will answer them during the final few minutes of the webinar. During the presentation, all microphones will be muted. If you wish to ask a question at the end of the presentation, please feel free to raise your hand and we will enable your microphone to be unmuted. Lastly, and just a reminder, this meeting will be recorded. We will be publishing it on our website in the news and events section for those who are not able to attend the session today. I would like to acknowledge the Indigenous peoples of all the land that we are on today. While we meet today on a virtual platform, I would like us to take a moment to acknowledge the importance of the lands which we call home. We do this to acknowledge the importance of the lands which we call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and improving our own understanding of local Indigenous peoples and their cultures. From coast to coast to coast, we acknowledge the ancestral and unceded territories of all the Inuit, Métis, and First Nations people that call this land home. Sepsis Canada is a nationally coordinated research network with over 200 members and representation from universities and academic institutes across Canada. Funded by the Canadian Institutes of Health Research, Sepsis Canada brings together experts from various disciplines working collaboratively on interrelated projects under an integrated and unified program. Our mission is reducing the burden of sepsis for all Canadians. Sepsis Canada has created 3 teams within our network. And through the Sepsis Canada Summit Series, you will have a chance to hear from all 3 teams, which will include updates on their current projects, progress to date, and their next steps. And with that, I would like to introduce you to the team in today's presentation. As the co-lead for Team 2, Project 8, Dr. Patricia Fontela is an assistant professor in the Department of Pediatrics at McGill University and a staff physician within the Division of Pediatric Critical Care Medicine at the Montreal Children's Hospital. Her research focuses on infection control in the pediatric critical care setting. Currently, she studies the use of antibiotics in pediatric critical care units, including the determinants that influence antibiotic usage, the clinical reasoning behind antibiotic-related decisions, and the use of biomarkers to guide antibiotic treatments in this setting. The other co-lead on this project is Dr. Dominique Piquette, who is an adult critical care staff physician in the Department of Critical Care Medicine of Sunnybrook, and an assistant professor in the Interdepartmental Division of Critical Care Medicine at the University of Toronto, and is a center researcher at the Wilson Center. Dr. Piquette's current research interests are primarily focused on better understanding how physicians learn in changing critical care clinical environments at the postgraduate and post-certification levels. In order to achieve this goal, she uses a range of research methodologies, including quantitative and qualitative approaches. Dr. Piquette is also actively engaged in critical care curriculum development and evaluation, as well as teaching at multiple levels. And last but certainly not least, joining us via video recording, we have Deirdre Walsh. Deirdre is a patient researcher and patient partner in the sepsis and inflammatory bowel disease research communities. She has 25 years of lived experience with chronic illness, ME, CSF, myalgic encephalitis, as a caregiver to people with complex diseases. As a patient researcher, Deirdre is trained in peer-to-peer qualitative research through the Patient and Community Engagement Research PACER program at the University of Calgary. While an intern in the program, she co-led the search for support, young adults and their experiences finding their way with inflammatory bowel disease. In other projects, she mentored an IBD team through PACER and led a qualitative study on patient preferences in IBD. As a patient partner, Deirdre has specific interests in patient experiences with ME/CSF, long COVID, and post-sepsis syndrome. And with that, I will now turn it over to the presenters to take it away.
So thank you today for the opportunity to present to you and have this conversation. I will share my screen and I'm going to present you some slides. But the idea here is to give you time for questions and to have a dialogue about the two programs that we are proposing here, the Sepsis Canada training program and the Lifting Health Research training platform. So I'm Patricia Fontela, one of the co-leads, and I hope you will enjoy the presentation. So the objectives here is really to present the principles and the goals of these two research training programs and also an overview of the proposed program so you can understand what we are trying to achieve here and if you join it, what you're getting into. I have no conflicts of interest to declare. So let's talk about the brief history of this program. So as you know, Sepsis Canada was funded in 2020 by CIHR. And one of the projects, one of the deliverables of this initiative, it was to create and implement the Sepsis Canada Research Training Program, that we want to be a single cohesive training and mentoring plan that will span throughout the 4 pillars of the health research. And we want it to be anchored in a multidisciplinary approach and also equity, diversity, and inclusion. So after we start working on this program, CIHR released a call for a competition for research training platforms. And we decided to expand the Sepsis Canada research training program to all acute illness disease research. And so we created the life-threatening illness national group, Lifting Research Training Platform, and we were awarded a grant by CIHR in 2022, and the PIs are Dominique Piquette, that you already know, myself, and Denise Jarowski. So here, both programs, they are very similar, and they are anchored in 4 basic principles. One, we want to break silos between different groups, different research fields, different disciplines, professions. So we really want a very inclusive program where everybody will understand the perspective of other stakeholders and key players in sepsis research and also acute illness research. Also, we want to offer personalized training here. This program is for people who already have experience in research or none at all. Some people will be doing a graduate program. Some people will be early career researchers. So each person will have a different objective. And we really want to personalize the experience that they are going to have in the programs. And we are going to work with them and towards the achieving their objectives. Also, as I said, both programs are really anchored on equity, diversity, and inclusion. We really want to bring to the table different stakeholders and key players from the research community and also from minorities and indigenous communities and citizens, because we do believe in that research is something that is done for patients, by patients, and because of patients. And also it's evidence-based training. We really are working on an evidence-based curriculum, and also we use evaluation strategies that evidence-based, trying to generate a very novel and high quality program that we expect will positively impact Canadian research training. So our goal, as I said, is to create this cohesive training and mentoring program, because mentoring is very important for us, to foster trainees' personal and professional development, not only in research methodology, but also in practical and professional aspects of the research academic life that include, for example, work in a multidisciplinary team, understanding research ethics, and also being aware and mindful about indigenous ways of knowing and anti-oppressive practice and social justice. So we really want the trainees to have a very comprehensive training experience. We also want to strengthen the sustainability of both programs, and what we want to do is to provide trainees with links to collaboration. So we want them to build a network of collaborators, and also employment opportunities in their field of study. So you're going to see later in the presentation how we are going to foster that. And ultimately, our goal is really to create a community of Sepsis Canada and lifting graduates. So people will feel that they are part of this group where they can share their ideas, receive feedback, find collaborators, and together they are going to move forward to build high quality research in sepsis and acute illness in Canada. So what are the characteristics of the program? So first is that Sepsis Canada and the lifting programs, they do not replace a graduate degree. They are complementary to it. So you are going to have, as a trainee, some training in research, but also in professional and personal skills that will help to ensure the trainee's success in both academic and non-academic research settings. This is a 2-year virtual training program, and the reason it's virtual is because we want to make it accessible across Canada for different trainees. And our group of trainees is very heterogeneous, as I said. They all have a life beyond the training program, and we are very mindful of that. And they may pursue research career in academic and non-academic settings, and this is encompassed by the program. So who are the trainees? Who is our audience there? As I said, our trainees group is very heterogeneous, and we aim to bring together early career researchers, graduate students, postdoctoral fellows, patient and family partners, research coordinators, other healthcare professionals, and also community members. And the reason we want to do that is because we believe that each of them will bring a different but very important perspective to sepsis research. And this is what is going to make the research that they are going to produce very useful to our patients. So in terms of the competencies that we want to teach to our trainees, they encompass these different areas: research methods, ethics and equity, diversity and inclusion, patient partnership, research management and dissemination, some personal skills, and some professional skills. So this is the Sepsis Canada training path. So in year 1, all trainees are going to participate in the core curriculum that will give them an overview of the basic aspects of the 3 different streams that we have: the biomedical stream, patient and family partnership stream, and clinical population health system and services stream. In year 2, trainees will choose one of the 3 streams, and they are going to complete courses in their streams. There are a core curriculum for each stream, but as you can see here, they also can have electives in any of the other streams. So this is really to provide them this comprehensive view of sepsis research and expand their understanding of different aspects of it. We also are going to have a mentorship program that is going to be, I'm going to talk about it after, and an annual symposium for all trainees. We are going to provide training awards, 3 per year, 1 per stream, and also the possibility of experiential learning in different fields of research. So let's talk a little bit about the clinical population health and health system services research stream. So what are we trying to achieve here? So this is a comprehensive program that will train the participants in different epidemiological methods applied to sepsis research, and encompasses, as I said, other personal and professional skills. Who would be a trainee in this stream? So people that want to establish themselves as independent sepsis investigators in this research field, or people who want to be involved in this type of research, but without the goal of leading studies. They can be advocates, collaborators, and or site leads, for example. For the biomedical research streams, the goals are very similar, but they focus on biomedical research, meaning bench research related to sepsis. And again, it's for people who want to establish themselves as sepsis biomedical researchers or have an interest in this field, but they don't want to lead studies. They just want to participate and collaborate in it. And finally, for patients and family partners, we have a stream dedicated to them, and they have 3 different paths. We are going to provide training for patients to become sepsis researchers, and we have in our group, as you saw, Deirdre, and also Marilyn Gill, that is also a patient partner who are researchers. We also will have a path for patients that want to support sepsis research as a collaborator in a team, in different boards that can work on patient-oriented outcomes or patient-oriented sepsis research. And also we are going to have a path for patients that want to have a more knowledge translation type of role. So they are going to support other patients, and they are going to help us to communicate research findings to patients and to the community, and develop knowledge translation material that it's going to be useful and that will be able to be understood by different stakeholders and communities and patients. The lifting training paths are a little bit different. So they have 3 streams. The investigator stream, so for trainees who want to develop their own research programs and interdisciplinary research teams. A collaborator streams open for people that want to actively engage in research, in the research process, but not necessarily want to lead a research project, and one specific stream for research coordinators. So that can produce their own research studies, or they can become very skilled in helping us to launch, develop, and manage programs and research projects. So one thing that it's important for the trainees to know is that you can participate in the Sepsis Canada program only, or you can do both programs, and you're going to see how they overlap and see how this is possible. So just to give you a brief overview of how the curriculum, the online curriculum was developed. So we use a virtual learning platform through McMaster University. And as I said, the year 1, you're going to have the core Sepsis Canada modules. So all the trainees will be together during all the courses in year 1 to build the sense of community and to learn different perspectives. And after it, in year 2, they can have the core stream modules. So they're going to choose a stream, and there will be a core curriculum for each of the streams. And after it, they can choose different elective modules in whatever stream they want to choose. Lifting uses the same principle for it. So core lifting platform modules, and year 2, they are going to have the core stream modules plus electives. So here you're going to see how lifting and Sepsis Canada, they overlap. So in year 1, the core year, you are going to have this type of modules. We are going to touch basic aspects of qualitative and quantitative studies design, to have an introduction to basic sciences and also health services and population health research. We are going to talk about research ethics, patient engagement, indigenous ways of knowing, principles of anti-oppressive practice and social justice, patient and family partner roles, and health policy and decision making. For Sepsis Canada trainees, because we are going to be doing research, sepsis research, we need to understand sepsis a little bit more in depth. So we are going to have specific modules on pathophysiology of sepsis, overview of the sepsis epidemiology, and microbiology of sepsis. In year 2, so the stream year for Sepsis Canada, for the clinical population health and health system services streams, these are the modules that the trainees will have available, will have offered to them. So we are going to have advanced courses in some of the topics that were presented in year 1, but we are going to also go more in depth in other designs of clinical research. For the biomedical research stream, the same thing. We are going to go more in depth in some of the aspects of sepsis and how research in these specific areas is performed. And for the patient partners and family partners, these are the 3 paths that we set. So there are specific courses for patient becoming researchers. There are patient specific courses for modules for patients supporting other patients and patient supporting research. Lifting for year 2, you're going to see that some of the courses or the modules that are offered will overlap with Sepsis Canada. So lifting trainees and Sepsis Canada trainees will still be able to take some courses together. But you see that the investigator stream also has different modules there for the lifting program. The collaborator stream, the topics are very similar to the investigator stream, but the focus is more for someone that it's going to collaborate in research, but it will not lead research project, so not that in depth, and also focusing on other aspects that will be useful for collaborators. And for the research coordinator stream, we are going to have very specific topics about how to launch, how to manage, and I study multidisciplinary and multi-site study. And we are going to focus a lot on good clinical practice and also standard operating procedures. Both programs will also offer workshops, and they are going to be common to both programs, and they are going to be focusing on research skills, and these are some of the topics that you are going to have available to you. Some of them will focus on professional skills, and some of them will be focusing on personal skills. Some of these workshops will be offered throughout the year using the virtual learning platform that we have. Some of them will be offered in our annual symposium, the ones that we really want people to be there in person and collaborating, the multidisciplinary ones that we want to allow students to provide the opportunity for the trainees to see different perspectives and how this makes their research richer. So these workshops will be more during the annual symposium that we are going to have. So as I mentioned before, mentorship is extremely important for these programs, and also it's really important for anyone that is starting a research career. Mentors are really essential for you to not hit walls and be able to have a smoother path, especially when launching a research program or starting an academic position, or even starting collaborating in a team. So we do believe in mentorship, and this is an important aspect for both programs. And we are going to provide two different types of mentorship. One is a group mentorship type, when we are going to have groups of trainees and one or two mentors, and we are going to have mentorship from a more experienced person to the trainees, and also peer-to-peer mentorship to really share experiences and try to find solutions together. We think that this is very powerful for the trainees. And also we are going to foster the individual mentorship, so meaning to try to find an individual mentor for each of the trainees. These mentors could be pre-identified. Some of the trainees will arrive to the program already having a mentor, but if not, Sepsis Canada and Lifting, we are going to try to help the trainees to identify an individual mentor to help them in their research endeavors. And these are the expectations for mentors and mentees. The mentors that when we talk about mentors, we talk about someone that will be a good role model for the trainee, will be available, respectful, that can provide advice on research training and research career, and that will also facilitate networking opportunities and also guide in decision making. And for the mentees, because this is a relationship that to work well, both mentors and mentees, they need to be very proactive. So what we expect for the mentees is for them to take initiative in the relationship with the mentor, to have a respectful attitude, and set the way they are going to work together with the mentor in terms of frequency of meetings, scope of the mentorship, because this is how they are going to get the best out of this relationship. So I had mentioned before that we plan to have an annual symposium in the spring, that the first one would be in 2023. So the goals, the main goal, the overall goal of the annual symposium is to bring together trainees and mentors from all streams. So the symposium will have some workshops that we want all trainees to participate together, to have this sense of community, and also to be exposed to different perspectives. And we are going to also have some of them, of the workshops will be on research skills, but some of them will be on professional and personal skills. We also will have trainees presentations. They can present the progress of their projects as a posters or oral presentation. And it's during the annual symposium that we are going to meet with trainees and mentors to do an evaluation of the progress, to have a chat about how everything is going, to refine their program, the curriculum, personalized curriculum, because sometimes objectives change, and we want the program to suit the needs of the trainees. And all of this will be done during the annual symposium. So in terms of training awards and experiential learning, Sepsis Canada will provide 3 awards per trainee, per cohort of trainees. So 1 per each stream. It's a 25,000 award each. And also we are going to provide experiential learning. So for trainees that are presenting a good academic standing, meaning that they participate in the online curriculum and they are participating in the mentoring activities and in the annual symposium, we are going to help them to organize a personalized practicum. And it's possible that we are going to be able to offer a stipend for this practicum that could be, for example, to join another research team, a different research team, to learn how they work, or it could be, for example, to shadow public health officers for a certain period of time to experience this type of research field. Could be in a non-academic setting, could be industry, or it could be just being inserted in a research project, for example, as a patient partner, as a collaborator. Different goals, different trainees, different goals, different practicums, following our principle of a personalized training. So in terms of the application process, the application process for the first cohort is open. The deadline for the application is June 1st. The application package is quite simple. There is a simple application form, a personal statement. Why do you think this program will be beneficial to you? What do you expect to get out of the program? How you're going to contribute? A CV and a letter of support, and you can email it to Andrew, who is one of our program managers, or for the ones that cannot use an email, prefer by mail, could also be mail to us. The selection process will be held in June, and we are going to evaluate the applications, and we are going to invite some candidates for a mini interview, because we want to know the candidates and understand their needs a little bit better. So this link here brings you to our webpage that Christine was kind enough to help us to build, and has all the information that you need regarding the application process. So before we finish here, Christine will take over and will present a video that one of our patient partners did for us as their contribution for this presentation, and gives their perspective of this program. And I think this is extremely important and valuable for you guys to understand what we are trying to achieve here. And after it, we open for questions. Thank you very much.
And now we'll take a deeper dive into what it means to integrate patient and family partners into sepsis research. As Christine mentioned earlier, my name is Deirdre Walsh, and I am a patient partner for this research training program. I am one of 4 patient partners on the training and education team, and we meet along with the scientists and clinicians. My wonderful colleagues on the patient partner team, Christine Russell, Marie-Maxine Bergeron, and Marlon Gill. Together, we have developed this exciting program that will teach research skills to patient and family partners alongside of the scientists. This is a tremendous opportunity for everyone involved. It is an innovative and flexible program that is designed to bring patients and their experiences into the heart of research. So why integrate patients and family partners into sepsis research? I did a quick survey of some of the team members to ask them this question. And they came back with very interesting comments. One said, "We will be teaching patients and researchers how to work together for better outcomes in sepsis research and treatments." Another said, educated patient partners and advocates are increasingly important in sharing information about health and medicine. We learned a lot through the pandemic about how health misinformation can flourish when patients don't have a strong voice in sharing the benefits of research. Another noted that it's really important to emphasize the role of the patient partner in research. This program has been developed to train patient scientists and to help break down silos. By doing so, this will foster open collaboration within all aspects of health research. Someone said, I really want patients to feel empowered to apply for this program. I also want researchers who attend this program to understand the value of patient and family partners and what they can bring to their research. One noted, I would add that a patient partner can help scientists think outside the box with their lived experience. They can also have an influence on research priorities. And for our patient partners, patient engagement and training can help the healing process of survivors and their families. So a lot of real value in breaking down those silos and contributing to sepsis research together. So how are the patient and family partners included in the training program? There are 3 substreams for patient partners and 3 different roles for them to think about taking on within sepsis research. One is an advocacy role, one is an advisory role, and another is the role of a researcher. So we'll take these one by one. The advocacy stream, we've called that patients supporting patients. And this substream will help patient and family partners to develop knowledge translation skills, including using different venues to communicate research findings, developing knowledge translation materials, and providing peer support. Storytelling will be a huge part of this stream. And then there's an advisor stream. We call that patient supporting researchers. This substream focuses on preparing patient and family partners to take on the role of a patient advisor within research teams. The skills that will be learned will include sharing perspectives on future research directions, on study design, grant applications, and many of the other research concerns. And another stream, which is really very innovative for this program, is the researcher stream. And we've called that patients becoming researchers. This substream will train patient and family partners in the fundamentals of qualitative research, data gathering, and focus groups. This will provide them with the necessary skills to run independent qualitative research segments within larger studies. The together in the same courses to begin the process of breaking down those silos. In the second year, patient and family partners can choose where they would like to focus their time and energy. The patient partner stream will be guided and co-taught by patients who have been trained in methodologies for peer-to-peer patient research, advocacy, advisor roles, and other patient roles in health research. A core goal of the program is for patient and family partners to learn these skills and then become teachers and mentors for the new sepsis patient partners as the program rolls out. So what experience do patients and family partners need to join the program? It's very simple. Either to be a patient or caregiver with experience of sepsis and curiosity. Patient and family partners are strongly encouraged to apply to the program if they have any interest in being involved with the research that Sepsis Canada is doing. We want you to be empowered to apply for the program. So in order to do that, we have some resources for you to find out more about the program and whether it's right for you. The first place to start is the Sepsis Canada Training Programs website, and the web address is right here. You'll find on that page that there's background information. There is a video about the program. There are click down menus towards the bottom where you will find out a lot more about the philosophy of the program, the reason that it was developed. There is another click down that will help you understand what you need to do to apply to the program. And there is contact information for if you need to find out more information further to that. That's just another bit of a scroll through. So it's at www.sepsiscanada.ca/training-programs. And that's where you will find a good chunk of the information that you'll need to make a decision about this.
I think there's a bit of a glitch in the video here. So I'm just gonna fast forward it slightly.
Even more, to find out even more, there are two ways to go about doing this. You can email the program manager of the program, Andrew Logidici, and he will be happy to give you any information, answer any questions that you have. Or you can join Andrew and I for a question and answer webinar next Tuesday, May 24th at 5 p.m. EST, if that works for your schedule. And I would suggest emailing Andrew for a Zoom link for that. And everyone in the program is deeply invested in supporting sepsis patient and family partners, to be able to hear your voice in research, see your skills, teach skills, and see your skills. Thank you.
And that's that. And so now we can open the floor to questions. I'll put Andrew's email address in the chat box. On that page, the training page there, you will find the Zoom link for the Q&A on Tuesday at 5 p.m. Eastern. There is a link to join that live Q&A session with Andrew and Deirdre. And I know Alan has two questions and his hand is up, so I'm going to let him go first, and then I'll move to the chat box because there is a question in there that I will go to next. And I'm just going to stop sharing so we can see everybody's face.
Okay, thank you. Patricia, I have 2.5 questions, and I'll start with the easiest ones. When does the first group actually begin their curriculum, and how many hours a week is the curriculum in the first year? So that's my first question.
So it starts in September and go from September to June. Of course, there is some time off in December, like everybody else. Mm-hmm. And we estimated that it's around 70 hours per year. So in core year. So 70 hours total for the trainees. If you want to do both programs, this would bring you to 80 hours. And this we are talking, but all the modules. So 7. So you can count like 7 hours per month. So it would be 1 full day of work per month that you could count.
Thank you for that. Are these curricula and courses already designed, and are the instructors already recruited? And I'm asking that because for people who are trying to balance whether to enter this program or one of the local CIP programs, can prospective people who want to be in this or think about this program actually see the curriculum?
Yeah, we are building our page on the McMaster website, because our learning management platform is with Mac. And soon the year 1, it's almost ready. So we are going to have that with the syllabus and all the courses, and the material is already there and everything, the supplemental material. For the lecturers, we are starting to invite them, and for year 1 and year 2, we are focusing more on year 1 because it starts in September right now. But we are contacting our partners. We have a list of people already, and we have been contacting the different partners of Sepsis Canada and Lifting, because we want this to also be very inclusive, and to find different partners with different expertise and be able to expose our trainees to different perspectives there.
Okay, my last question is for the clinicians who are looking to become clinician scientists. There's only one, the salary support, but there's only 3 of them per year. Really only 2 if you think about it for the clinician scientists possibly. And the amount of money is relatively small compared to what clinicians usually make, even trainee clinicians. So so what we've done in the past, for instance, for our CIP students is people can do a week of, a handful of weeks of working in the ICU makes it possible to put a roof over your head and all of those sort of things. Is that possible to do while being in this program?
So the training awards that we have, think about them as grants, not as bursaries. So this is for the trainees to develop a project. For example, it's a pilot project or supplement a grant that you used. We offered, probably we're going to be able to offer a small stipend for practicum, but we are not going to be able to offer a bursary for people. We would love to, but unfortunately this, with the grant that both grants that we received, we are not going to be able to do that. However, what the program is going to be able to pay for is the participation of the trainees in the annual symposium. This will be covered by the program for sure. So again, the CIP program, yes, it's tied to a master's or a PhD, and usually these people already have a bursary or are trying to find a bursary to supplement. This, unfortunately, we don't have this capacity right now. If we have partners in the future that could offer that, we would love, but that right now, no. This what we can do is the annual symposium is covered, the practicum probably there is a stipend, and offer per cohort 1 grant. It would be a pilot grant for a project.
So people will be able to work around and do some clinical work.
Yeah, Alan, this, as I said, all the trainees, they have a life beyond this program, and we are very mindful about that. And so that's why the amount of work that is it's associated to the program, we try to make it as small as possible, as minimal as possible, so they can do their other activities, but at the same time to get the benefit of participating in Sepsis Canada program or lifting program. Yeah.
Okay. There is a question in the chat box just regarding the flexibility around the deadline to apply, just because it does seem to be a shorter.
Yeah. Yeah, this is a great question, and we apologize for the short deadline, but we cannot allow this to go, for example, in the summer, because we are going to have some interviews with the trainees, and if not, it's not going to be possible. But if in your network you identify people that, for example, would like to participate, and you know that they are not going to be able to put the application, just send us a list. I think for this year, what we can do, send us a list with their names, send it to Andrew, and we can track if we have received these applications, and if not, we can touch bases with these people and say, are you still thinking about applying? And be a little bit more flexible this year, definitely. Okay.
Kathleen?
Hi, yes, this sounds really exciting. I did want to ask, this may be answered when you post the syllabus, but is there, and I know you mentioned there's information about data management. Is the program going to cover any pieces related to AI or machine learning that for sepsis recognition?
So of course, with AI and machine learning, you can have not only a PhD, a career in this, and it's going to be, we are not going to be able to cover everything, but yes, we would love to have a module to talk about it. Probably this will be in the clinical stream, and it's going to be an advanced topic, because people who want to talk about it, they have the interest, and so and we want to dive a little bit more and bring together, for example, a network of people that work on it, so you can know your peers and understand what they are doing in this area and find collaborators there. But definitely it's one of the topics that we have in mind. Yeah.
Perfect, thanks.
Okay.
Any other questions? Nope. Just a reminder, there will be the Q&A on Tuesday afternoon, evening, depending on your time zone. This will be posted to the website, and the Q&A we will record and post to the website as well. So there'll be that opportunity there. Andrew did put his email address, I see, in the chat. So we'll be able to, you'll be able to connect with him with any questions that you have there. So once again, I thank everyone for joining. I did put our next webinar, which is June 15th, which will have team 3, the NPSP, which is the National Preclinical Sepsis Platform, with Drs. Lalou, McDonald, and Mendelsohn presenting, which is June 15th. It's not a Thursday, it's a Wednesday, just to some conflicting times for the presenters. And we hope to see everyone there. There's the link to register now, or it will also be on our website as well. Thanks, everyone. Thanks for joining.
Thank you all.